To cultivate safety and quality in patient care, it is important that team members feel they can be a voice for safety. Patient safety is based on our ability to communicate effectively within multidisciplinary teams, as well as with patients and their carers. One key factor that enables us to communicate effectively in health teams is psychological safety. Psychological safety is the shared belief that it's okay to speak up and take interpersonal risks. These interpersonal risks may take the form of contradicting others, asking questions, or sharing new or alternative ideas. If a team is high in psychological safety, team members believe that they will not be punished, blamed, or humiliated if they share their ideas, questions, concerns, or mistakes. By allowing team members to feel that they can speak up about their experiences and safety concerns, psychological safety in healthcare allows clinicians to become voices for patient safety. In a psychologically safe environment, risks can be identified and addressed as clinicians trust that any information they share will be used effectively to support improvement and not to judge them. In a complex, multidisciplinary environment such as the healthcare system, psychological safety enables effective communication and promotes the delivery of safe and reliable care to patients. Amy Edmondson describes 3 key ways in which we can cultivate psychological safety within our healthcare teams. 1. Frame work as a learning problem. We don't all know everything about the complex and adaptive systems we work in, so every person's perspective is important. We can use this approach by making statements that encourage others to speak up, such as, "We've never been here before. We can't know what will happen. We've got to have everybody's brains and voices in the game." 2. Acknowledge your own fallibility. Create a safe space for speaking up by normalizing the idea that we don't know everything. We can make simple statements that allow others to speak up, such as, "I may miss something. I need to hear from you." 3. Model curiosity by asking questions. Encourage others to contribute to discussions by asking questions to understand other people's perspectives. We can acknowledge others who speak up. For example, "Thank you for sharing your experience. It really helps us understand what is going on." Together, we can build an organizational culture focused on psychological safety. Find out more about Amy Edmondson's work on 3 ways to create psychological safety in healthcare. Head to the Clinical Excellence Commission site for more information.